Second.
Hello, everybody. My name is Amanda Dounis, and I'm from the Positive Thinking Clinic. IBS and IBD are topics that so many people come into the clinic, and whilst they're here for a certain specific reason, I often discover that clients will mention that they also wouldn't mind getting some help on relaxation and stress reduction for their IBS situation. Now, I've decided to do an expert conversation with another expert, and her name is Mirela, and in a moment I will get her to introduce herself. Now, I'm a counsellor, psychotherapist, and hypnotherapist, and so I know that IBD, IBS is to be treated with a medical professional and with the right guidance from a nutritionist. And my role would be to support in relaxation and stress reduction. Now, I know holistically when we accompany certain different wellness techniques from nutrition, medication, diet, stress, relaxation, then we can gather or collect really nice results for individuals. Mirela, can you please introduce yourself?
Sure. My name is Mirela Simic. I am nutritionist and a PT and owner of Mela's Nutrition and Training, which is a private training studio in St. Susie.
Now, Mirela, I think it's a great opportunity for us to get together and have this conversation. Now, some of our listeners will have not much knowledge about IBS and what it is, and therefore that may draw their attention to listen to see symptoms, treatment, causes, because they will become curious. It's not only education, but it might be a way of them to relate what's going on with their digestive system or their stress levels or any of their experiences. And then we'll have listeners who are experiencing IBD, IBS. Now, I know in my clinic, it was only last week where I had a session with one of my clients who I've been treating for IBS. Now, like I mentioned in our introduction, she does consult with a nutritionist and she is under medical supervision. But she did say what I really wanted to hear. She said, my symptoms are much more reduced right now. I'm actually feeling quite good. And she did say, I feel our psychotherapy sessions are working because I'm less stressed. And in addition to that, she added, she said, for some reason, I'm not struggling with making better decisions with what I eat and what the choices that I make. So I know from my perspective that it's useful to get some psychotherapy or counseling or hypnotherapy just to help you relax and become more aware of yourself. What's your take nutritionally, Mirela?
Well, first, let me just explain briefly what IBS is. So it pretty much is disorder of our gastrointestinal tract, and that can represent itself as a cramping, as abdominal pain, changes between constipation or diarrhea in some clients, bloating, sensation of incomplete bowel emptying, mucus in the stools, nausea. So there can be a whole range of symptoms people can be experiencing with the IBS. It's also important to mention that, it can be caused, sorry, it's a bit loud. So it can be caused by bacterial or viral infection, bacterial imbalances in our gastrointestinal tract, SIBO, food intolerances. So there are a lot of different causes that could possibly trigger IBS and make it worse. Now, what I find is with working with a client, it's not enough just to put in nutritional strategies in. And mind you, every client might have different approach for targeting IBS dependingly on what's causing it. But what I've found with a lot of my clients is that stress and anxiety, they do play a large role. And when someone is feeling more stressed and more anxious, they do feel more abdominal bloating, more pain, and other symptoms present. When I work with clients, I usually tell them, look, you don't really need to see nutritionist as much when it comes to treating IBS, because I can pretty much, start you on the right track. But what makes the biggest difference is how you tackle your everyday stress. And this is something that either makes people better or worse. What do you think in your experiences with working with your clients?
I know that stress definitely aggravates symptoms. And that's where I can actually help. Stress doesn't cause them, but it aggravates them. And that's why some mindfulness techniques, some meditation techniques, learning how to, even guided visualization, guided imagery to connect with themselves to help reduce stresses. I know that pair that with the changes that they make with food, that it can go hand in hand, and it can definitely make the ultimate result, which is I feel better, because that's what they want. They want to get rid of the discomfort. And we know stress causes the discomfort. Stress causes discomfort even in people who don't have IBS. And so that's why learning to manage stress is extremely important for everybody and every age. And then there's complications that I have come to learn about when it comes to the IBS as well. For example, even poor quality of lifestyle, or even mood disorders. Experiencing signs and symptoms of IBS, often I've heard and experienced, and even the literature says, Mirela, that it can lead to depression and anxiety.
Yeah.
And at the same time, depression and anxiety can make IBS worse.
Yeah, it is a bit of a vicious cycle that sometimes people get caught. And this is why sometimes people are really not aware of how lifestyle that we lead, what influence it has on our overall health. And I think once when clients that I work with, finally they realize, no, hang on, I do need to take better care of myself. Exercise does help, but also seeing a counselor or hypnotherapist can help me even further, because unfortunately we live in these times when there's so much stressors from everywhere, and sometimes people are not quite sure how to tackle those ones. So what do you find it that works the best with working with your clients in reducing stress and anxiety to help them with better management of IBS?
Well, to be quite honest, I actually trained myself with an IBS package, and the person that I trained under, and therefore I'm heavily influenced by his work, is Dr. Richard Nogard. Now, what tends to work is something a little bit more, I don't know if you want to call it long-term or short-term, but it's about 7 sessions. And the reason why we do this is because, like with everything, it takes time. It's small steps. And so, for example, on one session, we may work on autogenic training and connecting with ourselves. Another session, we'll work on mindfulness. Another session, we may work on, well, let me just quickly, if we have a couple of minutes, I will just quickly go through what each session would involve, because someone who now is interested in, what would you be doing in 7 sessions? I have my notes in front of me, so I actually will just look at the main points. So on the first session,
I'd really like to hear how your sessions work. So thank you for that.
Okay, good. So let's imagine now someone comes in and they are already under medical advice. They've already got a nutrition plan. So they've already done the proper background medical stuff and nutritional stuff. And they come to me because the doctor or somebody or even themselves are saying, but I need to help relax and I need to help reduce my stresses, because the advice is reduce that and your symptoms will also reduce. So with my model, the first session will be a basic process of self-hypnosis and learning the basics of autogenic training and mindfulness. And it's important that we do this in the very first session. Once this is practiced, from the very first session, relief should be provided. And this is how. So for those who don't know what autogenic training is, it's just like creating from within. So it's a simple way of creating sensations within your body and feelings within your hands, within your feet, and with your solar plexus. The solar plexus, we also known as core for those who are in athletics or physical training. It's the muscle that's right underneath the sternum, behind the stomach. And they say it's the core center of gravity. In metaphysics, the solar plexus is that seat of nerves, where some actually say that the essence of our life resides. So it's really pretty interesting to be able to give yourself in this session suggestions for creating feelings. And that's what we do. And I haven't had one client that doesn't experience the sensations where we say, feel this, and now do you feel the temperature change? Or feel this, and now experience that. So that very first session is quite interesting and is amazing for each client because it's what they are connecting within their own body and within themselves. Then we move on, and that's just so the foundations, right? Then we have, on our second session, what we pretty much do is I encourage them to let their mind create an image in some way that represents their gut working correctly. Now, it's really important to have positive guided imagery. So we create with our thoughts, and by creating our representation in our own mind of our gut working well, then in essence, we feel that we have taken control with our mind of how we experience our gut. It might be a visualization, but by amplifying this image and by making it as strong and as clear as possible, the clients then leave knowing that they've been able to create control and even influence of their guts. Now, people do this for competitions, for job interviews, for many areas of their life. So this is not something unique to just IBS. Then what we do is, let me bring up my notes so we can see, okay, this session is a gut-directed approach. And so we use hypnotic suggestions so that we can relate the mind, body, or to give it a relationship. Even suggestions that are related to how we interpret pain or other signals. This is an extremely important session because quite often clients come in with their mind already made up with their own relationship that they have to pain. And so let's just call it the power of thought. We are, in essence, not just what we eat, we are what we think as well. And so we use the autogenic training that we learned in the first session to imagine a bit of warmth. And we know in hypnosis, we can create sensations. And this is just not my personal opinion, but this is what the literature says as well. And so what people do in this session is channel the power of their mind into their gut, giving them a calm feeling or a calm sensation. And they notice a moment of soothing. And we allow them to enjoy this and to practice this over the next week until they come to the next session. What they take away is their hand is their tool. Because with the autogenic training and the mind-gut relationship and the self-hypnosis and the visualization, they now have an NLP technique which they use as which they are using their hand as their technique. Very quickly, the very next session is they continue to learn to take control of their stomach, or let's call it their gut, rather than their gut controlling them, because they usually have the impression that all their issues are controlling them. So now they take back control, and they've already learned how to do this with their tool, their hand that we spoke about, and by bringing themselves to a sense of calm. So it's just like self-soothing. We do it in our lives throughout different stresses anyway, but we haven't given ourselves the opportunity to learn how to do that when we have discomfort in the gut. So in this session, what dominates is a metaphor. Metaphors are extremely important in hypnosis and very powerful. Then on our fifth session, and of course I'm going through this very quickly so that I can give you more opportunity, Mirela, we do the body scan meditation. By now, they are more open to this, and they have led to the baby steps so that they can do their body scan meditation. But unlike progressive muscle relaxation, the purpose of the body scan is not relaxation. The purpose is mindful awareness of the body, its sensations, and our thoughts about the body. So like a basic strategy for mindfulness, it's important to be non-judgmental. The purpose of these meditations is to train an awareness that does not create relationships between thoughts and sensations, or between awarenesses and actions. And so what they do is they go away with homework, and twice a day until the next session, they practice body scans. Then we have the second last session. And what they do is we learn in this session, because people are always focusing on where the pain is and what hurts and what's not going right, we teach clients to focus on wellness. And focusing an experience that is within you, with your cells and everything that is, or your organs and everything that is running well, then we use this to create a wellness relationship and move that to the area of discomfort that we usually experience with symptoms of IBS and IBD. And our very last session puts it all together. Now, by now, it's 7 weeks later, or even longer if the sessions are more than 1 week apart, but usually they're 1 week apart because we like to intensify this relaxation training. And by now they've mastered self-hypnosis on controlling their gut. And anytime they find that they have experienced discomfort, they can retrieve about 5, 6, 7 skills that they've learned through the course of IBS to decrease their symptoms, to relax. And when they relax, they learn how to settle, they learn how to focus away from discomfort so they can feel better. And the ultimate result is a decrease in stress. Sorry that I rushed through that, but I know that you just wanted a snapshot of that. What do you think of that now, Mirela?
That's awesome. I love it. I love that it's 7 weeks. And if I can say 7 weeks is actually short. So if I can say what you do is short-term sessions that have a long-term effects, positive effects on them, if they utilize it properly. Like, once when they put everything that you teach them in place, in those 7 weeks, those things that they learn from you, they can last them a lifetime. There is only certain amount of times that magnesium and other relaxing supplements can help them, and nutrition and supplements on itself is not enough for treatment of IBS most of the times. So I really love the outline of your program, and it really does offer a lot. And I love it how you teach clients, to also scan their own body and start learning more and getting more in tune with them. So I actually really like the sound of your course.
I knew you would like that, Mirela, because I know that when you are with your clients and they are asking you questions about nutrition and what pathways they should take, I've often heard you say to them, listen to your body. Take the time, pay attention to what you're experiencing. And I see you also give your clients the opportunity to say, I like this and I don't like that. And you make it very personal. And so do you find when you're treating someone with IBS that you are flexible in what pathway they take as well nutritionally?
I'm flexible with every client I work with, and it's a bit like negotiations with the clients. Look, I always say, what do you feel if you try this? And sometimes it's a trial and error. Sometimes it works for clients, sometimes it doesn't. And I find it like, even with the IBS, it depends what's causing this IBS and what's behind it. So, and if I have someone that's having IBS problems due to the food intolerances, then I will have a different approach to someone who has IBS due to the high anxiety, high stress, and bacterial infection. So I have to be flexible with every client I come in contract, in touch. And, with every client, I often listen to their lifestyle. I listen to what their life is like, and then I give the advice based on their lifestyle and what is going to work for them. Because if I just, put one diet for everyone, it's going to be impossible to follow it. It's not going to suit everyone. Not everyone's personality and lifestyle are going to mold it in. So it's not going to really work. But in saying that, I can give all the dietary advice I can. If times are not consistent, nothing's going to work. And this is why I really like the sound of your 7-week, course in treating the IBS, because you do teach them slowly over 7 weeks, and you certainly let them develop certain habits that are going to last them longer.
Yeah, and it's also a tool set that they can use at other moments of their life. Let's say they experience stress for a different reason. At least they've learned something that they can refer back to. What about I know that we've only got a couple minutes left, but do you find the role of sleep extremely important as well when it comes to IBS?
Yes, I do, because I find it when people don't sleep enough and don't sleep well, they're gonna have more stress and they're gonna have a lot more anxiety. So tackling sleep issues is also very important and one of the priorities there. And let's not just forget, once when someone's sleep deprived, they're also going to have more cravings. They're going to eat more. And in those moments, they might eat certain foods that could make their symptoms worse as well. What do you
That's true.
What do you find it with you, with working with your clients? What effect does sleep have?
I always ask my clients about sleep, no matter what the issue that is that they bring in, because I know sleep is one of the most important things for healing, for repairing, and it's an opportunity to allow the body to rest, relax, detox. And if they're not sleeping, it's also, I'd like to know why, what's keeping you awake, and what strategies can we use. And we look at sleep hygiene, and we look at what stimulants they're experiencing, whether it's visual stimulants, emotional stimulants, or something that they're eating or drinking late at night. So I believe sleep is extremely important for all ages, at least rest for sleep. So a lot of the time stress likes to sneak in and cause rumination and overthinking when it's time to actually lay in bed and sleep. But funny enough, they may say, oh, and at nighttime, my stomach is really uncomfortable. And so therefore we look at everything. So yes, I'm with you, Mirela. Sleep is extremely important.
Definitely. Amanda, I have to jet off because I actually have a client coming soon.
Okay. So Mirela, I'd like to say thank you to you. You've given us wonderful information. And if anybody wants to get in contact with you, how is the best way for them to do it?
They can either go to my website, www.melasnt.com.au, or just text me on my mobile number on 041 044 7173.
Fantastic. Thank you, Mirela. I'll see you next time.
Thank you. Bye.
Bye.